So yes, so that's a really interesting disease, hereditary angioedema. It is genetic. It is a dominant disease, meaning you only have to have one abnormal chromosome or gene, I should say. So if you have one abnormal, that one that's left over is not enough to contain the generation of bradykinin. So the genetics is important because that means by chance it's every other child or 50% of the family will actually get HAE. I mean, you can't say 50% but each time each baby has a flip of a coin chance. So the thing is, if you have that abnormality, you don't make enough C1 inhibitor protein. And without C1 inhibitor protein, there's an activation of factor 12, and then factor 12 activates kallikrein, and kallikrein causes high molecular weight cholinesterol defragment. One part of that becomes bradykinin, binds to the receptor. When it binds to the receptor, it generates cyclic GMP, prostacyclin, and nitric oxide. And then what happens, if you look at the cells in the endothelial line in the vessels, you can actually see the tight junctions between those cells dissolve. And there's little microfilaments of myosin that develop inside the cell, pulling that cell inward, almost like a muscle would be on your body. And you can see why then the fluid would shift from the intravascular space into the interstitial space because of that lack of the tight junction and the cells retreating from each other. So it's a really interesting disease because it's all generated by bradykinin. The problem is too, is that it takes a long time for that fluid to build up and then also to resolve. So some of these people have like 3 days, even 5 days of swelling, unfortunately so. And, if it's in your stomach, that means you're vomiting and so on for 3 to 5 days. If it's in your hand, maybe you won't be able to type, or if it's in your foot, you may not be able to walk. Or really, if it's in your neck, you may go to heaven, unfortunately so, because asphyxia or upper airway swelling can lead to asphyxia and death. Yeah, so one of the major limitations of this disease, unfortunately, is recognition. Once you're diagnosed, the data is really good, that actually a probability of having good health care and so on is good. Prior to that, it's often that you're receiving really poor health care. And so if you go in for a belly attack, a lot of times emergency room physicians will think you're seeking narcotics. If you go in with, belly pain, some of these people actually end up getting unnecessary surgery. If they get swelling, say, of the face, the doctors are more likely to say, I know how to treat this. You treat it with antihistamines and steroids and epinephrine, but hereditary angioedema swelling is resistant to those three. So it's often the patients and the doctors are having competitive type of relationship. Um, Once the diagnosis occurs, that can take up to 3 to 5 doctors and 7 to 10 years. Then what happens is the person finds usually someone who knows the disease. They get proper treatment. The doctor understands the disease. They use shared decision making and so on. So it really is a paradigm shift once the diagnosis is made.